On this episode of the Drtyna Show, I'm going to be talking all things alternatives to HRT. Because so many of you come into my DMs asking me, Dr. Tina, I can't take HRT. I can't tolerate it. I'm having adverse reactions to it. It's a contraindication for me. I have a past or current history of breast cancer or estrogen positive cancer. My doctor said absolutely not. I don't know what to do. What can I do? Am I just screwed? That's the question I get from so many of you. And so I want to break it down in this episode today. So let's jump in. You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtyna.com. First off, I want to be very clear. There are so many factors that go into success with HRT. And now I'm going to call it hormone replacement therapy because I'm not just replacing menopausal women's hormones. I'm utilizing hormone replacement therapy for folks as young as sometimes their late 20s, early 30s. I replace the hormones that are physiologically deficient. And I might sprinkle a tiny little bit on. This is where I came up with my microdosing GLP-1 strategy, because sometimes we just need the tiniest little bit of something that we are not making enough of, or our cells are not hearing it appropriately, and we have symptoms. And so we can utilize hormone replacement therapy. Most often, I would say in younger women, I'm not pulling out estrogen. It's very often progesterone. And sometimes I'll bring on some testosterone even before I'll bring on the estrogen, because testosterone can aromatize into estrogen. And then eventually we usually bring on the estrogen as the woman progresses into perimenopause. But I mean, shoot, even a few short years ago when I was talking about getting your HRT on board before you're menopausal, I was catching heat for it. And now that's kind of the going knowledge online, right? That's what everyone's saying, like, do it sooner than later. And I wholeheartedly agree. There's no reason. I mean, I can't imagine if I had not brought estrogen on board when I did, I would be in a heap of trouble. So I get it. I get that you guys are having symptoms. I get that you're having pain. I get that you're having joint pain. I get that you're having tissues tearing. Ligaments and tendons like to start tearing as estrogen leaves the building. I get that you might be having terribly low progesterone symptoms earlier, like infertility and heavy periods for the entirety of your life, and nobody bothered to check. Anxiety, sleep issues. I mean, the sleep issues alone, even at younger years, chronic urinary tract infections in younger women might be an estrogen issue. We are looking at brain fog and brain changes and mood changes and depression often as women go through the perimenopause and menopause transition. There's a whole laundry list. Urinary frequency. That's not just a need for topical estrogen vaginally. That is estrogen leaving the building, and all of a sudden, out of nowhere, you're like, I have to pee right now and I can't hold it. And I used to have a bladder like oxen, like not a chipmunk. I could hold it. And now I'm like, oh, I got to pee. So these are all symptoms of hormones leaving the body. Most often estrogen is the one that you're told you can't have. That's most often the one people don't tolerate well. That can be due to a whole litany of reasons. And I want to just say this clearly. If you're working with a doctor who tells you that you don't need to worry about functional medicine or integrative approach, or just take the hormones and you'll be fine, that is nonsense. There's no version where successful application of hormone replacement therapy goes well without a truly integrative approach. There's just no way. There's too many variables. There's too many variables. And more often than not, we're not just throwing hormones at someone. We're utilizing herbal medicine. We're making sure nutritional deficiencies are addressed. We are making sure gut health is huge for how you tolerate your hormones. We have to make sure you're pooping every day before we put estrogen into that system. We have to make sure that your visceral fat is under control before we give you something that might make it worse. We have to make sure that, and why do I say that? Because testosterone therapy will indeed make things worse if a woman is aromatizing badly enough. And that could be genetic, that could be just the way she's built, that could be her lifestyle factors. We have to make sure your lifestyle is dialed in, because if we take a hot mess of inflammation, i.e. the typical American middle-aged woman who is metabolically compromised, under-muscled, over-fat, not judging, that's just how most of us are built in middle age, and then we throw estrogen at that body, it doesn't necessarily go well. And in most cases, it doesn't go well, in my experience. I have never found HRT, just blanket approach, easy. The only patients I've seen it go easily in And as expected, are women who are decently lean, exercising frequently, in really great shape, eating well, metabolically optimized. Those women I can apply HRT to and have some semblance of hope that it's going to be a pretty simple case. More often than not, it's like trying to hit a moving target. And the more inflamed, the more adiposity, the more metabolically compromised. 94% of US adults are metabolically compromised. That was 2018 data. We know it is probably way worse now, post-COVID. So, because everybody was locked up for how long? Your air quality, your toxicity level overall, your stress levels, your sleep, the foods you're choosing to eat, the alcohol you're choosing to drink, the history that you came into this with is so huge, you guys. The path you took to get to middle age. Did you grow up in a mining town? Did you grow up somewhere where the water was super toxic? Were you in a house with smokers, smoking indoors? Did you yourself smoke? Did you start drinking at a young age? Have you been on pharmaceuticals your whole life? Have you been on birth control? I mean, that's a whole other variable. That's like a whole wrench in the system. Taking a woman off of birth control and putting her on HRT, like that's an art. I don't enjoy it. All of these are variables as to why you may not tolerate your HRT. So don't give up so easily. Consider a second opinion. Consider a third opinion. So many of you guys come into my DMs and said, well, my doctor said I can't have it, or my doctor said, and I'm like, dude, you asked one person, usually a dude, and then you went on with your day and you decided that you're not a candidate. And I had a huge bum rush of followers recently. Like I got like 12,000 followers in 2 days. It was crazy. And the DMs were cuckoo cuckoo as far as how many women, because I had written in my stories that day about my bone density improvement on DEXA scan with HRT. And mind you, I was not training anywhere near as hard or as regularly or consuming as much protein as I had been on my prior DEXA scan. And yet my fat was higher, my muscle was lower, my visceral fat was higher, as to be expected. But my bone density score was like significantly improved. And the only variable there is, I had a little extra weight on me, so gravity helped, but it was the estrogen, you guys. And so I got a ton of messages back and replies to those stories from women saying, I'm scared to take hormones. My doctor said no. It's always my doctor said no. Don't stop there. Second opinion, third opinion. Don't just take the first opinion and go with it. You very well may be intolerant because you have other systems that are completely out of whack that need to be addressed. And in fact, I was just talking to a colleague, it takes me a good 9 months to fully onboard somebody onto a full HRT regimen. That's how much we have to get through. That's how much muck and mire we have to get through. I got to get them pooping every day. I got to get them hydrated. I got to get them eating well. I got to get them strength training, and not like saying they're strength training, but actually strength training. I have to get them eating nutrient dense. I have to get their stress under some semblance of control. There's a lot of factors. And I'll tell you, this is where GLP-1s are beautiful, you guys. They clean up a lot of this mess. For you practitioners out there who've been hesitant, you can use them intelligently and you can clean up a lot of this mess, because I am damned if I'm going to put estrogen into a body that is got excess adipose and really inflamed, and that patient isn't being super compliant. I need absolute compliance and commitment to the process. Otherwise, we're potentially just creating more inflammation and more of a mess. You don't know what pathways that estrogen is going to go down in a body that isn't doing its thing. There's genetic factors. There's methylation issues. There's all kinds of variables here that determine how your body handles it. Your gut microbiome and how it handles the estrogen, the conjugation, deconjugation. Do you poop it out? Do you recycle it? What is your liver doing as things go through first pass and become different intermediates? All of these are variables that need to be considered. And all of these systems are usually really out of whack in the middle-aged woman, particularly her metabolic health. So I know that was a lot, and that's a lot to unpack. Can't get into it here, but just know that those are all factors that need to be taken into consideration before you just bag it and say, oh, I don't tolerate HRT. I can't do it. Okay? Find someone who can help you, walk you through all that. Find someone who's going to run some extra tests and really look into it with you and really help you with the lifestyle pieces, because that's how you're going to tolerate the HRT best. Then there's those of you who it's a true contraindication. Now, I want to back up here. I know plenty of women who has a past history of breast cancer who's on HRT. I did a whole podcast episode with Dr. Corinne Men. She is a board certified menopause specialist. She is a breast cancer survivor herself. She breaks it all down in that episode. You can go listen to it. The whole point of that episode is get a second opinion, because a lot of doctors simply do not want, either they don't know how to manage that or they don't want to take on the risk. And I don't blame them. I don't blame them, you guys. We don't all have to be good at everything. I'm not good with pediatrics. I'm not good with proctology and urology. There are just things I do not do. I do not do them in my practice. And that doesn't mean I have to be good at everything, right? I'm really good at what I'm good at. And there's a lot of doctors out there that are not, especially if you're just going to your regular GP. They're not going to want to manage your hormones, especially if you have a contraindication anywhere. You could have a past history of blood clots. They know that transdermal estrogen is not going to increase your risk of blood clots, and they still don't want to manage it because that's time and energy and liability and risk that they don't want to take on. So don't get mad at them. Find someone who will take it on gladly. Find someone who is an expert at it. Find someone who does this all day long. Find someone who can help you. I can't give you personal referrals. I wish I could. Liability says I can't, and it's just literally impossible. There's too many of you asking. But I did create a free resource. It's over at drtyna.com/find a doc. I'll make sure it's in the show notes. It is a free video resource where I break down everything I would look for in a good skilled practitioner. So find someone that you can work with. I will tell you, you may have to go out of state. There may not be someone in your area. You're probably going to pay out of pocket because most of the really good ones don't take insurance. I don't blame them for that either, because insurance is a scam in my opinion. Did a whole podcast about that too. I'll make sure that's in the show notes. You want someone who's going to spend time with you, has expertise, and knows what they're doing. And you're just not going to find that inside the insurance system for the most part. The time part alone is not possible with insurance. They don't pay doctors to spend time with people, and they penalize them. So find someone that can help you. I'll just be straight with you. It comes down to risk tolerance for you and for the doctor, because I know many a person who passed from cancer. Their quality of life was more important to them than worrying about if the cancer was going to come back. They were so miserable without any hormones on board that they decided that they were willing to take that risk. And that's something to work with your practitioner on. Unfortunately, people are sue happy, and it's not even often the patient that sues, it's their family members. And so doctors are a little gun shy to take on a patient like that. But my point being is there are doctors that will work with you. And if you are a candidate, you maybe are just going to get your general doctor, your OBGYN. Most doctors are going to be like knee-jerk reaction, no way. And then you find someone who understands your type of cancer specifically. I'm not talking about active cancer. I'm talking about past history of breast cancer, being told you can never take hormones again. Find someone who can work with you and really look at you on a case-by-case individualized situation and see if you're a candidate. Okay? That's all. I'll leave it at that. So maybe you're intolerant. We covered that. Maybe you're an absolute contraindication. You can't do it. We're going to talk about that in a minute. Maybe you're somewhere in the middle and you've just been told no and you need to keep seeking. And if you really want to take your health into your own hands, you have to be proactive and you have to keep seeking. So grab that free resource, drtyna.com/find a doc. It will empower you. It will give you some questions to ask. It will help you understand better what you're dealing with. So for those of you who absolutely cannot take hormones, let's go through some information. First off, a lot of doctors out there are going to say, oh, yes, you have lots of alternatives. Yes, you have alternatives. No, you have no substitutes, though. Estrogen is estrogen. There's no substitute for it. Just like there's no substitute for a GLP-1. There's no supplement that's going to do it instead of. There's no way around the fact that a hormone, a progesterone, a testosterone, the hormone itself is a lock and key on a receptor in your cells, and it does a very specific thing. Even if there's medications that bind that receptor, the downstream pathway, the downstream reaction is different than what the hormone would do. So there's no substituting a hormone, which is a bummer, I know. So I might as well just be frank with that and come out with that. A lot of women want me to tell them there's something they can take instead of that will do exactly the same thing, that will give them that umbrella of protection that hormone was delivering while they had it. And that's just not the case. So don't let anyone tell you that. And then if you go looking and Googling, you're going to find a lot of blogs and a lot of resources going through the alternatives and kind of making it, even some of these FDA approved medications for like hot flashes, et cetera, making it sound really good and like, oh yeah, this is fine. It's just the same. It's not the same. So please know that up front and don't get mad. Don't shoot the messenger. I didn't make the rules. I didn't create physiology. God did. So this is where we're at. If you cannot tolerate estrogen, you are going to lose some of the benefit of having estrogen on board. And that is just how it is. There are therapeutics out there that may be able to help you with the side effects of not having estrogen on board anymore. And that's what we're going to talk about. So progesterone tends to be pretty safe. And I would say that that's one that most doctors who understand hormone replacement therapy, who are versed in it, are comfortable sharing with patients. Maybe not. I don't know. I was. Testosterone's different. It can aromatize into estrogen. And so therefore it may be out too. And let me back up. Whether you can take hormones or not, everything I'm about to tell you still applies. Do not assume because you're like, oh, I'm lucky, I get to take HRT, that you are immune to needing to follow the following rules I'm about to set down, because you have to do it too. We all have to do it. If you want your hormones to work optimally, you have to do the same thing as the people who can't take hormones so that they can help mitigate some of the side effects of not having hormones on board. So we're going to go through them. First off, I think the big one that people talk about when it comes to helping with side effects and alternatives is vasomotor symptoms or hot flashes. Hot flashes are not just a nuisance and uncomfortable. They are your vasculature spasming, which is, in my opinion, dangerous. And in the opinion of multiple studies, not great either. So no, I'm not fear-mongering. If you are getting a lot of hot flashes, that means your vasculature body-wide is spasming, and that is not good, right? That's we don't want to dislodge a plaque or have any issues. So we've got to get that under control. I will say the number one reason for hot flashes is metabolic dysfunction, poor metabolic health, which most middle-aged women are going into menopause with. And then you add on top that pulling estrogen out of the system, whether abruptly or slowly, because it's either declining naturally or you are on a estrogen blocking medication post breast cancer or post cancer, you will by default become more insulin resistant and more metabolically compromised just from the act of estrogen being out of the body or leaving the body or waning in the body. So you're fighting an uphill battle no matter what, whether you're someone who can or cannot take HRT. We are all fighting the same uphill battle. Past the age of, like, I would say 35 or 40, you have to actively start fighting because your immune system is completely contingent on your metabolic system, and your metabolic health overall is completely contingent on your muscle mass. And this is why I say that strength training is non-negotiable. And I'm talking progressive overload strength training, which is a subject for another day. But I go to the gym a lot, you guys, and I look at the middle-aged women, and 95% of them are not really making their time in the gym worth it at all. And I'm not judging. I did a reel the other day where I talked about this, and I got like 11,000 followers in 2 days. It was crazy. And if you're one of them, welcome. But it's a waste of reps and time if you're not progressively overloading. And progressive overload doesn't necessarily mean more weight. It could, but it could be, there's a variety of ways to progressively overload. You have to create such a tension and stimulus upon the muscle that you activate type 2 fibers and you induce muscle protein synthesis. If you don't get there, and that's usually grunty, ugly face. That's usually you having a grunty, ugly face. If you don't get there, you're not inducing muscle protein synthesis, which is like, what's the point? There's no point into picking those weights up then. You might as well, honestly, and I know people argue with me, you might as well just not, because you're completely wasting your time unless you are progressively overloading. That doesn't mean you have to go to failure. It doesn't mean you have to pick up the heaviest weight in the room. It means you have to figure out what I go through this inside my Strength Vault. I explain this in detail, but you have to figure out where you are about to hit failure. You're 2 to 3 away from failure. And that, again, there's a variety of ways of doing it without just adding weight. So don't come at me like so many did during those few days of like, strength training with heavy weights is dangerous. No, it's not dangerous if you know what you're doing. And also, You don't have to lift heavy to have ugly, grunty face to get to the edge of failure. But that is a topic for another day. I would highly encourage you to hire somebody to help you with this. If this is not landing for you, find someone who can help you get there, because you don't want to hurt yourself and you don't want to do it wrong. But so many of you are wasting your time in the gym. Like, I see literally women go through the machines with just the one plate. They put the pin in. It's literally the 1 5-pound plate. And they do 10 and then they get off and they do the next one. And I'm like, what are you even doing? Like, what is happening here? What is happening? And these women have no legs and no butts, and they're skin and bones, or they're overweight and they have clearly no musculature in the lower body. And it doesn't matter what size you are. You need a dump truck. Like, we are trying to build a metabolic sink, and the biggest muscles of your body are your glutes and your thighs. And if you're not focusing there, you are not, I'm not talking to you 25-year-old girls. I'm talking to middle-aged women who are trying to offset actively happening metabolic dysfunction, because that is what ultimately leads to cancer, you guys. And we've proven this now that we have these studies coming out showing that GLP-1s are pretty much protective against, to some degree, against obesity-related cancers, because they are mitigating metabolic health. And metabolic health and your immune system, again, two sides of the same coin. So find a way to progressively overload. And if you don't understand it, grab my strength vault. I'll put the link in the show notes. It is in there. I describe it in detail. I have all the exercises for you. If you don't know how to use technology, please don't join, because we've had a few people who are just, I don't know what it is. They can't seem to get through working with it. It's a pretty simple system in there. It's a pretty simple navigation, but all the videos are there on how to do the exercises. The workouts are there. The explanation of progressive overload, the explanation of why you have to get to the edge of failure, all of it's in there so you fully understand what it is that you're doing. Because if you understand what you're doing and why, your workouts will get significantly better. But find someone to hire if you can. If you have the means to hire someone, start there. Far superior. You will get further faster without as many injuries. Okay, so most hot, flashy women I have found have metabolic dysfunction. And when we address the metabolic dysfunction, the vasomotor symptoms improve. Although, yes, as estrogen leaves the body, this can get worse, of course, but I also think that is because they are metabolically compromised. And we, no matter best efforts, we will all become more metabolically compromised as we progress through this journey, even if we have HRT on board. A side note here, us ladies on HRT are not immune to all of these things too. I'm on HRT and I'm cycling regularly, and I'm still having all kinds of symptoms here and there. It really depends on my stress levels. It depends on my sleep level, situation. It depends on, there's so many factors that go into how you're going to handle this transition phase. And so if you're stressed out of your mind, if you're carrying around excess adipose, especially visceral fat, if you're metabolically compromised, you're going to have a worse time. And your hot flashes and all kinds of other symptoms are probably going to be worse. So a lot of this comes down to lifestyle and what levers can we pull to improve our lifestyle? Cut the alcohol, get the alcohol out. It is destroying your sleep. Your hormones leaving the body are destroying your sleep. When your sleep is destroyed, you're metabolically compromised. Period. There's no fixing that. You cannot fix somebody who's metabolically compromised if their sleep isn't dialed in. So you got, there's things we got to do here. Okay, so how can we help with sleep? I don't have an answer for you. I have no alternative there. If you can't take hormones and your sleep is abysmal, I don't know what to tell you. There are, there's valerian, there's melatonin, there's different herbal concoctions, there's teas, there's winding down, there's, winding down all the lights, of course, and really having good sleep hygiene and getting the TV out of your room and winding down the lights and the stress and the noise in the house. There's rituals we can do, and there's things we can try to throw in there, and there's different sleep products that are out there that I think can be helpful. But man, if your estrogen is gone and your progesterone is low, sleep is really difficult. And then, of course, without good, adequate sleep, we have certain metabolic compromise. And so that one's really tough. I don't have an answer for you there. When it comes to bone health, there's bisphosphonates, which are medications that's first-line therapy for osteoporosis. I don't love them. I'm not going to go into it. there is these abnormal femoral fractures that occur. I've had multiple patients that have come to me who've post those types of fractures. The way I understand it is that, and there's some good data showing that this is too simplistic of what I'm about to say, but the way that I have always understood it is that while your bones look good on DEXA and on imaging when you're on bisphosphonates, the bone integrity itself is not as good. It's more chalky than it is healthy. And so the more recent studies that I've looked at show good activity of osteoblasts, more normalized activity than you would think of the osteoblast-osteoclast balance, and that you couldn't possibly have just chalky, dense bone that's worthless if these cells are showing such activity. I'm still not a huge fan of them. Talk to your doctor, though. I'm not giving you medical advice. I would not go on them. I would do squats and deadlifts and whatever else I had to do in the gym all day long before I would go on a bisphosphonate. And that's the part about bisphosphonates that aggravate me, is that they're considered first line when I don't know why strength training is not first line. Period. If you can take HRT, I don't know why strength training and estrogen replacement therapy are not first line therapy for every single woman in America and the world for that matter before we would reach for a pharmaceutical. But I think that that's kind of first line therapy for everything, if you ask me. If you're not strength training, then like you are missing the benefits of so many things. So your bone health, we know this to be true, and there's lots of great docs finally talking about it. If you have no ability to utilize estrogen, you can't take it, it's contraindicated, you have to be strength training if you want your bones to be healthy. You have to. And again, if you're not progressively overloading, you are wasting your reps. So please, particularly in this situation, find somebody who can train with you and help you, because you absolutely have to get the muscles pull on the bones. And yes, I know there's jumping, but this whole jumping thing has kind of aggravated me because women will do anything to get out of Bulgarian split squats and deadlifts and challenging moves. They just will. Women will do anything to get out of lifting heavy on the lower body. It's the most bizarre thing. And now they've got everyone convinced that they can just jump. Well, if you just jump off an 8-inch step 30 times, then no, the data didn't show that, actually. The data looked at people who jumped and lifted weights, and they lifted fairly heavy. It was like 85% of their 1 rep max, I believe. They were like pretty close to the edge. So it's the heavy lifting that the muscles pull on the bones. Your muscles and your bones are BFFs. If your muscles are unhealthy, if they're metabolically compromised, they're full of fatty infiltrate, they're insulin resistant, they're weak, they're deconditioned, they're frail, your bones are going to be exactly the same. And no amount of jumping is going to save you. So you can't get out of the split squats and the deadlifts. I'm sorry. You just can't. And if you can't do deadlifts, then we can find something else for you to do, right? There's things to do. That's why you need to work with someone. Because I get messages all the time. Well, I have bad knees. What do I do? I have this. What do I do? Hire a coach that can help you work around that joint, that can help you strengthen that joint. I can't tell you on the internet. It's like these whataboutisms. The people in my DMs come at me with such an incredible ability to argue for their limitations. It's so bizarre. It's so bizarre. Like, you have to do the work. There's no get out of jail free card. There's no easy button. You want to avoid breaking a hip when you get older, whether you're on HRT or not, you're going in the gym, you're doing progressive overload, you're getting close to failure, and you're lifting heavy on your lower body. That is the end of the conversation. And if you don't like me for saying that and you want to like unravel in the DMs or in the comments or in the whatever, I don't care. I don't read most of it anyway. I just want to be like, okay, good luck with your hip fracture. That doesn't end well either. Like, I'm going to throw some stats at you guys on hip fracture here in an upcoming episode, and it will scare the bejesus out of you, hopefully. So that is it. That's my rant. So that's your bone option, strength train. And then you've got your bisphosphonates. So there is an option for hot flashes that's FDA approved called Veoza. I'm not a huge fan of it. From what I understand, it puts undue stress on the liver, and the liver's already usually pretty stressed out in middle age because the body is already dealing with a fatty liver. Most people have fatty liver by then because they're metabolically compromised. They are pathways are not pathwaying as well as they could be because of nutritional deficiencies, because of stress load on the liver for life, you know? So again, like how you came into this somewhat dictates how you go through it. So not a huge fan of that. I would dial in my metabolic health. I'd get on a GLP-1, honestly, I wish they would do a study on GLP-1s and hot flashes. Like I wish that would happen, because I think that they will find then what I have always said, which is it's a metabolic dysfunction issue more than anything. If we can get your metabolic health dialed in, your hot flashes tend to dial in. Nobody wants to hear that, but that is what I believe wholeheartedly, personally and clinically. I only personally get hot flashes. I mean, I've taken care of many women with them, and we get their metabolic health dialed in and they feel so much better. And the hot flashes go way down or become much less severe, much less frequent. But then me personally, my own personal experience, 100%. If I've like been burning the candle at both ends, my stress level's high, I've been eating too many carbs, whatever it may be, my hot flashes are there. If I'm dialed in, my hot flashes are not there. So, and I'm not just basing this on an N of 1, which is me. Like I have had decades of experience working with these women. And this, again, where I think GLP-1s are miraculous. Done right, done appropriately. You know, I'm a big slow and low girl on that. You guys have heard, I've got a lot of content around that. Okay, what else can we talk about here that I think is critical for you to know? There is urinary frequency. That's a big symptom of menopause. You very safely can take, whether you have obviously talk to your doctor, but the consensus is if you have breast cancer, history of breast cancer, not active, history of breast cancer, and you've been told you can't use any estrogen replacement therapy, may very well be a candidate for vaginal estrogen use. And I talk about this with Dr. Men on the episode that I mentioned, Dr. Corinne Men, and we both believe, and so do many others, that vaginal estrogen can be very safe and effective. But I will say that urinary urgency is also a systemic estrogen issue, so it may not make all of that go away. You may still have some urgency without systemic estrogen on board. But vaginal it's a good start. Some of the advice, if you can't take HRT, is obviously what I mentioned, cut down on alcohol. Some websites will tell you to cut down on caffeine and spicy foods. I think caffeine and spicy foods are amazing, but if they make you feel terrible, then obviously discontinue them. And I've had to have some patients discontinue them. I think of spicy foods and caffeine, though, truly as longevity herbs. There's studies on it. There's no way around it. Like spicy foods vasodilate you, which is awesome. Get that nitric oxide going. Caffeine is neuroprotective. So if you can tolerate them, don't just take blanket advice, because I don't necessarily know if that's going to change your hot flashes. Only you will know that. And note that most of the talk around alternatives to HRT are around hot flashes, because that's the most uncomfortable thing that most women complain about. But I think pain is a huge symptom. I think urinary urgency. I think anxiety. I think sleeplessness, change in mood and affect, brain fog. All of those are some top symptoms that don't get nearly as much play as vasomotor symptoms. Make sure that you address all nutritional deficiencies. Work with somebody who can help you with that. Vitamin D, vitamin E, zinc, omega-3s, magnesium. Those are some of the top ones that can impact things. I'm not a huge fan of soy or phytoestrogens. I never have been. And all through school, all through all my training, that was what everyone said to give your perimenopausal and menopausal patients. Give them soy, give them soy. Thankfully, the North American Menopause Society came out with a statement in 2023, and they argue against soy, which, hallelujah, because I am not a fan of it. There's a lot that I don't think it's a super great food to be eating on the regular. Podcast for another day, perhaps. As for cardiovascular health, we know that bone density is protected by estrogen replacement therapy. We know that it can help with vasomotor symptoms. The cardiovascular argument is out there. Here's the thing about it, though, just quick and dirty. You're becoming more insulin resistant as your estrogen goes down. Your muscle quality is becoming more pathologic as your estrogen goes down. No matter what, no matter how hard you fight against it, your body is declining in those ways. You're becoming more metabolically compromised no matter what you do. Not to say you will become metabolically compromised or you will have pathologic muscle, but the process is going that direction unless you're actively fighting it, is what I'm trying to say. The metabolic compromise piece is huge. Our fat moves, it shifts from a gynoid shape to an android shape, which is more like a man, which is that apple shape. So we get that visceral fat and that truncal fat. That is going to significantly play into your cardiovascular health and impact it. There's a myriad of other things that happen when estrogen goes away, and all of those make cardiovascular disease risk higher. So this direct, like, oh, let's take women and give them estrogen and see if their cardiovascular markers change, I don't think that's entirely fair, because all of these other things are happening physiologically that definitely are leading you down the road to a higher risk of cardiovascular disease. And then on top of it, I have seen countless women's labs just shift like that overnight. They're perfect. And then all of a sudden, boom, serum insulin's high, lipids are all over the place, cholesterol goes through the roof, ApoB's high, LDL's really high, HDL plummets, triglycerides go up. That is definitely putting you at a higher risk. And that is happening because estrogen is leaving the body. There's no way around that. You can take HRT and you can mitigate those labs, but that process is happening. So what this means is not to freak you out. It is to let you know that your metabolic health is more important than anything. So you have to be even more diligent about how you choose to eat, and more diligent about how you choose to train, and more diligent about all the factors that are playing into your metabolic health, because all of those things are happening as estrogen leaves the body, and all of those things are increasing a woman's risk for cardiovascular disease. And it angers me so much that there's people online with high credentials that want to argue and say estrogen doesn't help with cardiovascular disease. And I'm like, are you kidding? Like, just look at basic physiology. It doesn't have to be a direct estrogen binds to heart cells act better. Like, that doesn't have to be there for all this other stuff to be true, right? Just simply having fatty infiltrate in your muscle and having the fat shift, the adipose shift around the body and change where you start depositing, like that alone is huge. So I don't know. I've seen countless women have their labs go sideways abruptly. We get their hormones dialed, their labs regulate out. And if you can't take estrogen, then you're going to have to go above and beyond to really make sure your metabolic health and the foods and the choices that you make and the lifestyle that you have is dialed in. I mean, I think it really needs to be dialed in for all of us, but it gets extra when you can't take estrogen because the risk is real. Okay, next up, some further alternatives. We've got herbal medicine, and I think that's a wonderful adjunct to the menopausal process. Whether you're taking HRT or not, whether you can or cannot take HRT, I still think herbs are awesome. Just know that some herbs stimulate your ovaries to do something. And if those ovaries are offline, then they're not going to be stimulated to do anything. I would not mess with herbs without talking to, if you have a history of breast cancer, work with someone who definitely knows what they're doing. Because if they're giving you medication to block your estrogen receptors and they don't want any estrogen in your body, then taking something like hops, for instance, drinking beer and hops are directly pro-estrogenic. Men listening, if you're a beer drinker, you're literally drinking an estrogen tincture. So just be careful what you do with herbs and supplements. If you are, post-cancer, if you're active cancer, don't listen to any of this and talk to whomever you're working with, whatever team of practitioners you've built around you, go with what they say because they are specializing in what's happening to you in this moment. But if you're post breast cancer and you want to dabble with, black cohosh, St. John's wort, dong quai, all of those, find an herbalist who knows what they're doing, who's comfortable working with you in your situation, because, herbs are powerful. They're not completely benign. They're medicine. They have an impact. Definitely the dose matters and the source matters and all of that. But more than anything, some of you may know this, you can kind of get yourself in trouble with herbs sometimes if you're not careful. There's maca, there's red clover, sage, milk thistle. Milk thistle is going to support the liver. Valerian and hops, very calming, I think are lovely, lovely herbs. Again, hops is directly proestrogenic, but there are herbs and nutrients that can help you sleep better. I think that's important to know. So keep trying. You never know what's going to work for you. I really like magnesium glycinate for sleep. I like valerian. I like melatonin. I think all of those can be appropriate, but work with somebody so you don't end up dinking around and hurting yourself. Evening primrose oil, I think, is beautiful. I think of Vitex, chaseberry, evening primrose oil, black cohosh, dongguai. I think of those as kind of like pre to perimenopause kind of hormone balancers. Once we're postmenopausal, it changes on how much impact the herbs can actually have. I'll just leave it at that. Some other therapies I think are fantastic are acupuncture, meditation, CBT, which is cognitive behavioral therapy. There's studies on cognitive behavioral therapy with hot flashes, decent results. I think it's worth trying. All of these things stack. So I think it's worth trying a multitude of interventions to see what helps you. But I love acupuncture, whether you're infertile or dealing with fertility issues and you're younger, whether you're dealing with terrible PMS, whether you're, not to say it fixes everything, but it has a really nice harmonizing impact, especially when you're working hard to do all the other things. Acupuncture can be such a beautiful adjunct. There is antidepressants, there's SSRIs, and I know people are going to come for me, but SSRIs can really help with some of the side effects of menopause. Now, I would prefer someone take estrogen and not need an SSRI, and I would prefer someone be able to take HRT in its plethora of options and not need, pharmaceutical intervention, but sometimes it can help. And I have seen women really struggling, even on HRT, and they take a tiny little dose of an SSRI, and it just takes it down a notch. Like, it just takes this crippling anxiety, because our brains are going through really severe changes as we go through this process. Just like when you are pregnant, your brain in postpartum, your brain goes through crazy changes. In fact, it shrinks away and then it comes back to a new normal. It stabilizes. And this is now the mother brain, which is a different brain than your pre-motherhood brain. And then we go through this process again as we go through menopause. And it can be horrific for some women. I just did a podcast with Dr. Noor, and we talked about this, like the depression I was experiencing, and the mood changes and the cognition changes were horrifying to me. There is a reason why women in middle-aged women are the highest group of women that unalive themselves once we get past like teenagers. But I still think middle-aged women, when you look at the stats, it's a higher stat. It's really devastating. And I think it's because of these brain changes, and we all have different brains. And so when women are out there like, you don't need hormones. Really, honey? Really? Because like your brain might be different than my brain, and my brain was not doing so good without estrogen. And so if you can't take estrogen and you're having a real difficult time, there are other tools out there, and I'm a big fan of using what we got and doing what we need to. That doesn't mean you have to take copious amounts of anything and lose your personality and go flat. But I have seen low doses of SSRIs and SNRIs, and gosh, there's a whole plethora of options out there that done. I think there's an elegant way to do it, and even if it's just for a transient amount of time, to kind of just take the edge off so that these women can function. There's a huge amount of women that leave the workforce in middle age because they literally can't function anymore. They literally can't do their job anymore. Can you imagine the impact this is having on society? Women are at the highest point in their career. They are potentially bringing skills to the workforce that we wouldn't have otherwise, or a level of expertise in these individual women doing phenomenal things in their respective careers. And then all of a sudden their brain fritzes out on them and they can't work anymore. And they're so appalled that they leave the workforce. So if we can take the estrogen, we take the estrogen. And if we can't, then we figure out how to keep the brain doing what it needs to do as best we can, right? Exercise is very helpful, very, very helpful. So just know. And then there's Tai Chi, there's different movements, there's Pilates and yoga. I think the flow state of some of those exercises, I'm talking classical Pilates, I think that can be very therapeutic to the body, to the mind. It's not just the exercise itself, it's the flow state that it allows you to get into. That is just a game changer. And so if you find yourself radiating, I know you don't want to do the grindy, heavy lifting, and you don't have to do that all the time. And I'm not asking you to CrossFit like a demon, but I am telling you that you have to progressively overload close to failure to get muscle protein synthesis and type 2 fibers kicked up. We want the type 2 fibers, ladies. That's how we have quick reaction time so we don't fall down and break a hip. And then we want to have some kind of flow state exercise. Maybe that's walking for you. Maybe you can get there through walking. Whatever works for you, but something rhythmic, maybe it's dancing. I think is why women love Zumba. Something, and jazzercise before that, something that gets you in a bit of a flow state can be really therapeutic for mind, body, and soul. Big deal. I talked about the vaginal estrogen. One of the big things out there is vaginal moisturizer. Now, note, there are some phenomenal vaginal moisturizers on the shelf, and to get on the shelf, they have to call themselves moisturizers. They may have active ingredients in them like DHEA and we also can find over-the-counter estriol, which is a form of estrogen. We can find over-the-counter progesterone. So there's things that you might find out there at your local health food store that is over-the-counter in a cream form. And now again, if you absolutely have a contraindication to any hormones, talk to your practitioner. But for those of you who are maybe you're just kind of like walking into perimenopause and you're noticing some atrophy or some dryness down there, we don't want to have like complete shutdown of your vaginal tissues. Don't let it get that far. Don't let it go that far, because it destroys your confidence. It leads to urinary tract infections. It leads to discomfort and pain, and you start associating intimacy with pain. It destroys marriages. It's not good. And it often starts with tissues atrophying down there. So take care of that tissue, ladies, and keep it healthy and keep it normal and pink and with good turgor. And if you can't, then find someone to help you, because that is a very early stage, I would say warning. It's a very early warning sign that your hormones are going awry. And if you are absolutely unable to take any estrogen and you are a breast cancer or post-cancer survivor, find something that you can apply topically that is safe and is approved by your physicians that will help you maintain the integrity of those tissues. Because ultimately, it's just urinary tract infections that it leads to. And those are terrible as you become older. And there's a senility that can happen where you're just constantly rocking a urinary tract infection, and it's now impacting your cognition, making you a fall risk and everything else. And I'm sure we've seen this in some of our loved ones and some of our older grandmas and things. So as estrogen leaves the body, we lose the suppleness and juiciness and elasticity of our tissues. And my first symptomology that really got my attention was everything kept tearing and I kept injuring myself over and over and over again out of nowhere. I went from being injury-free for a decade to suddenly like every little thing I did, I was tearing tissues. And I was like, what the heck is going on here? This is so awful. And things were not healing well. That's another one. Your tissues are not healing well. That is telling you that your tissue integrity is compromised, and it's probably because estrogen has left the building and maybe some testosterone has left the building too. You've lost any kind of anabolic impact. And whether you're on HRT or no HRT, do not lose your flexibility. Do not lose that suppleness of your tissues. Do not lose the ability to flex and pull and move and create tension throughout your body, because that's just walking into a bad injury if you don't keep it. The ladies that I know that have aged the best have all maintained flexibility to some degree. The ones that get like this and super tight, and I know because, man, when estrogen was leaving me, I got so tight and I literally was walking hunched over because I was in so much pain and I was so tight and I was just losing that beautiful posture that I am so proud of having because I built it. I used to have terrible posture and then I built really nice posture. And all of a sudden I'm like this again. And I'm wanting to curl up in fetal position. Everything hurts and everything's stiff as a board and everything feels like it's just going to rip if I move too far. That's lack of estrogen. And so if you can't take any estrogen, figure out a way to work through what you need to. Maybe you get in a hot sauna, a hot room. Maybe you do it post-exercise. I'm not a huge fan of pre-exercise stretching, but if you're prone to injury, you got to warm up. So keep yourself supple. That's what I'm getting after here. And if you are having a really hard time, if you are not having a contraindication or intolerance to hormones and you are finding yourself losing that suppleness and that flexibility, that might be an early warning sign. Your vaginal tissues, your anxiety levels, which is kind of hard to gauge because the world is crazy. So you never like, why am I anxious? Well, there's a million reasons I could be, but the flexibility piece and then the constant, that was a big one for most of my patients. That was kind of the first sign that I would have to sit down and talk to them and say, hey, you may be a candidate for HRT. And they were like, no, I don't need hormones yet. And I'm like, dude, you're in here with an injury like every other week, whether it's a man or woman. I'm like, something is going wrong here and your hormones are leaving the building and you are tearing everything all the time, because predominantly my patients were athletic. So that was an early symptom, and it was really hard to get these people to believe me and to go even test or to treat. And then they would test and it might not, because it's perimenopause, right? So it might not even come back as being off, and they're like, I'm not going to do it. The ones who listened and actually took the hormones were like, oh my God, this is a game changer. And then all these other symptoms that I was having have gone away that I've noticed, like my crippling anxiety and my depression and, my urinary urgency and my inability to sleep and on and on. And my skin is so nice. So something to consider. I think aerobic exercise is equally as important at this point as strength training. I say that begrudgingly because I hate cardio, and I myself am not getting enough cardio. And I literally just had like a talking to with myself yesterday. Yesterday, I was like, we must implement more cardio, Tina. And I hate it, but I think it's pretty critical because of flexibility. We have to keep those vessels flexible. We have to keep the lung tissue flexible. We got to keep the cardiovascular system flexible. I'm not saying go run a marathon, but I do think cardio has more of a role in my life than it did, say, 10 years ago. And I'm going to start doing more of it. We could talk about zone 2. I think that's lovely. I think walking is not cardio, but walking is also lovely. I do like sprint intervals. I kind of like it all, but at the end of the day, do it after your strength training. Just for the sake of this podcast, just do it after your strength training, because you want to reserve the muscle protein synthesis signal for the strength training. We don't want to shoot in the foot by doing cardio prior. We want to do it after. So I used to do it before. I didn't know this. Do it after. You're metabolically primed. Your fatty acid oxidation is kicked on from the strength training. Now go burn it up with the cardio. So do it after. But exercise regularly. If you're not exercising in middle age, period, hormones or no hormones, you are missing the boat. You're missing the boat completely. I will tell you that there are different delivery systems, and many of you are being given progestins. You're being given equine estrogen and progestins. Equine estrogen is not bioidentical. Estradiol is. Estriol is. Those don't have to be compounded. You can get them from your traditional pharmacy down the road. Brand name prescription estradiol is bioidentical. I had a doctor recently tell a patient that she's cleared to take HRT, but just not BHRT. And I was like, dude, tell me you don't know what you're talking about by telling me, like, what are you talking about? All estradiol that is bioidentical to the body's estradiol. It doesn't have to be compounded. It can come from a standard pharmacy. The micronized progesterone that we get from the standard pharmacy or compounded is bioidentical. Progestins are not bioidentical. Equine estrogen is not. And these are not my favorite choices. I think we can run into trouble, but this is all that some women are being offered. And then they're progesterone intolerant, but actually they're progestin intolerant. And the scary outcomes from the Women's Health Initiative study from over 20 years ago, that was done with progestins. And so I'm not a fan of progestins. I don't prescribe them. I know sometimes in a pinch when we're talking about like thickening of the uterine lining, the Menopause Society says pull out the progestins, but I begrudgingly would do that if I had to. I haven't had to yet, fortunately, with any of my patients. So I'm not a fan of them. And I think that's why some people are having progesterone intolerance. I also think that you could be underdosed or overdosed on your progesterone, even if you're taking a micronized bioidentical. I think the form you're taking it in, like for instance, I tried a sublingual troche at one point. I got so sick. I puked my guts out for weeks. I finally gave it up. It felt like I had morning sickness when I was pregnant. I can't do that. I can handle oral just fine. I can handle vaginal just fine. I used to use topical for years and years and years, although you don't get that allopregnanolone benefit out of a topical. But there are different delivery systems is my point. I talked about this with Dr. Noor a little bit on that episode. And I think that progesterone intolerance comes down to A, people taking something they think is a progesterone and it's not. B, the delivery system. C, it might be something else going on with them that needs to be investigated, which I covered in the first part of this podcast. Was, look at your overall health, look at your gut health, look at your metabolic health, look at your sleep, look at your stress levels, and figure out, because hormones are it's just a balancing act, right? Sometimes people will get horrific migraines and headaches. They will get mood and anxiety and rage changes. I think that in some cases, what we're seeing happen is, in its most simplistic terms, and this is not the formal physiology of it, but the way I was taught early on is when you see somebody react that way to progesterone therapy, you maybe are underdosing them because it kind of makes the estrogen you already have work better, if you will. And so you may actually be pushing, if you're a practitioner using progesterone in a patient, you may be pushing them into a little bit of an estrogen dominant picture, and you actually have to get the progesterone dose up high enough to overcome that. And so I know it sounds counterintuitive, and when women are having a hard time with a dose, you're like, I'm not going to give them more. But in this case, you may be underdosed. And I've seen that plenty of times. Now, it's a fine line. And a little bit too much of progesterone suddenly gives you all the same symptoms of having too little. And next thing you know, you're like gobbling. I did a whole podcast about this too. You're gobbling up carbohydrates, you're gaining weight, you're sleeping great, but it's all over the map. So bottom line is, yes, I think telemedicine companies are a great way to access hormones. They're not always the best way to manage someone on hormones. So a lot of you, I know that's the only route that you have to get what you need because your doctors aren't cooperating or your doctors are new to this. A lot of doctors are new to this. They're opposed to it because they don't want to deal with it. I don't blame them either. Dealing with hormones in middle-aged women is not a fun process always. And so I understand why some doctors just don't even want to do it in their practice and they tell you no. But instead of telling you no, a lot of them will just tell you you're not a candidate, which is unfair and untrue, potentially. That's why I say get another opinion. Find someone who really loves doing it. My colleague loved doing hormones. I sent everybody to her after a while. When I got sick of dealing with it all the time, I was like, you take on all of these complicated hormonal cases, and she absolutely loves it. That's her wheelhouse. Happy as a clam. I handled the situations where I was doing musculoskeletal medicine. So I was just trying to get people out of pain, and then I would refer them on for long-term management to her. It was a beautiful relationship we built out over years, right? She would send them back when they were ready to have treatments done and they were optimized, whatever it takes. I'm not opposed to the hormones, though, is my point. And a lot of doctors will just tell you, oh, you're not a candidate, or they'll kind of go with some, it's like medieval thinking in a lot of ways. And they're medieval about how they handle thyroid. They're medieval about how they handle hormones. They haven't gotten on the tip of the spear yet. And there's a lot of doctors who are really excited to prescribe hormones that are brand new to it. And I think that's freaking awesome because we got some of the black box warnings taken off, but they're brand new to it. So if you don't fit, they took a weekend workshop or they took an online course and now they're prescribing. And so they don't have a ton of experience yet either. That's okay. Work with them, but just know that if they can't figure it out, they might be inclined to be like, oh, well, let's discontinue it then. I used to do that when I was brand new. I would be like, well, if it's making you feel terrible, stop taking it. That's not always the answer. And sometimes we got to work through and get past. So find someone who really digs it and wants to help you and work with you and who's good at it, because you may have progesterone intolerance, but you might actually not. And you may have estrogen intolerance, but you might not actually. And you just haven't had the other factors dealt with. So find someone who's integrative if you can too, because that will help. So that's it. Remember, go to drtyna.com/find a doc. If you're trying to get started in strength training, I have a wonderful beginner's program. It's called the Strength Vault. I'll make sure that's in the show notes too. I have a whole section in there where I describe what it is I'm talking about. When we're talking about progressive overload and training to failure, it is the lesson I wish I had gotten when I was starting out. I have a book. When you go to sign up for the Strength Vault, there is a book that you can add on to the order. That's the first 90 days of like what I wish I knew going into strength training as far as like gym culture goes, what to expect. There's so much more to this that I think gets women to quit early. And if they just had more information, maybe they'd stick with it. So you guys can check that out there. And that's it. I hope you guys enjoyed the episode. If you like this episode, please go rate, review, and subscribe on your favorite podcast player. Please make sure you're following me on YouTube. If you're watching it here, make sure you're subscribed. Then you'll get updated information when I release new videos. If you're not yet, go follow me on Instagram. It's booming over there right now for some reason. So we're having fun. I'm trying to post there more regularly. I took pretty much a year off of Instagram and just posted some things haphazardly. So I'm trying to get back in the swing of things. And I'm going to be talking a lot more about all of this there that I can. Hopefully I don't get censored again. And that's it. So I will talk to you guys later. And thanks so much for being a listener of the Dr. Tina Show. Thanks for listening to the Dr. Tina Show. This is a Wellness Loud production produced by Drake Peterson. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.